Hello, right. So this is the first session of the summit and is data and digital services to support the recovery of global health systems. And it's my pleasure to introduce Carolina as the moderator. And she is the co-chair of the summit and a colleague of mine, both at the Digital Health Society and the European Connected Health Alliance. Under her careful leadership, our project's work is going from strength to strength. Carolina has an MA in political sciences and future studies, has over 12 years experience in international projects in health and well-being. She has worked for WHO on the European Health Cities Network, for My Data Global, and she has a special interest in how technology and data can support the sustainable health systems of tomorrow, health literacy, and the socioeconomic determinants of health. Her professional mission is to bring bridges between the different sectors for more just and sustainable futures. Or as Brian O'Connor would say, she connects the dots. Carolina, over to you.
Thank you so much, Bladen, for this very nice introduction, and welcome again, everyone. Good morning, good afternoon, whenever you're joining us today. You've just heard from me in the introduction to the summit, but here I am hosting this interesting session, Data and Digital Services to Support the Recovery of Global Health Systems. Bladen already, this is also the topic of our summit, and Bladen did a great job introducing the different angles of this topic previously, and he said that we have here the message, we want to bring message of hope through this summit. And of course, we when we put the session together, when we thought about the recovery of health, of global health systems, we had in mind the global pandemic, recovery from the global pandemic. But in fact, we know today that we are in different crises, and some people start to call it a perma crisis. So how we actually can support with the data and digital services our health systems that we don't collapse. Today with me are four speakers representing different profiles and also different experiences and perspectives, both representing public authorities, practitioners, and people that work in research and deal with policymaking. So today with me is Angela Brandt, who is a full professor in the Department of International Health at University of Maastricht, and she's also director at the Digital Health Society. We have Eddie O'Neill, who is a doctor in pre-hospital urgent care and a technologist and director at Department of Health of Northern Ireland. Then we have the representative from the Republic of Ireland, Martin Curley, who is the director of the Digital Transformation and Open Innovation at the Health Service Executive, that helping enable the digital transformation of Ireland's health service. And then we have Julien Venne, director at the Digital Health Society, and as researcher, Julien is affiliated to the United Nations University, the University of Maastricht, and the Manipal Academy of Higher Education in India, where he is heading later this week. Thank you for joining me today for this discussion. We will first invite you all to share some reflections in regard to this topic. How can data and digital services can support the recovery of health systems? And then I would like to engage in a discussion with you to ask you some questions. And I also encourage our audience to ask the questions through the chat functions. We will pick the questions and bring them to the speakers. So here I would like to invite you, Angela, to share your thoughts on the topic. You represent the academia, but also have the very broad perspective. So can we start from you? I think you have some slides.
Thank you very much, Carolina. I will share them now with you. And Let's go. So first, I would like to start with two general remarks. Data and digital services. They are a technological innovation and a social innovation, of course, and they need to go hand in hand. So a technological innovation, there we think always about the analytical tools, big data, AI, including, of course, machine learning, deep learning, which allows us a digitalization, so the ability to collect data, to establish trends, to make better predictions and decisions, and even under high level of uncertainty, like we saw it during the COVID pandemic. And then to be able to have effective analysis, real world data, real world evidence. Then it allows, for example, the development of new drugs, drug repurposing, etc. And then we have, of course, also the enabling technologies, Internet of Things, sensoring, 3D printing, quantum computing, post-quantum, etc. Then a social innovation, of course, because the citizens are really in the driver's seat. We see that more and more citizens want to be, and they are in control of their own health data. And that's a topic of this summit. It's transforming a lot health systems, costs, responsibilities, etc. So the topic of the summit, digitalization, supporting the recovery of global health systems. We see there success stories or best practices of the old health and policy approach, which means crossing sectors, health as a policy crossing all sectors, environment, trade, safety, economy, justice, etc., and also borders, so regional, national, globally, and also involving really all stakeholders. But I think that, I guess Julien will later come back to these aspects of social innovation. So my focus now will be here in this context of communication, the role of communication, and I see it mainly as a social innovation. So my first slide is what I think are the three top stakeholders. It's for me government, traditional medicine, and traditional media, and social media. And government had in these times a learning curve to use different ways of communication in different situations, in different phases. So for example, we saw during the COVID pandemic, a change from really top-down and direct information in the beginning to a discourse, then also from tables to infographics, then also what information should be provided in that momentum, in real-time information to the people. Yeah, really a different task. Then the traditional media as a second stakeholder. They had a learning curve already some time ago when they moved from print media to television. And all people said, well, print media might be dead, but it was opposite. So nowadays they really complement each other, and print media experience a renaissance even by taking different avatars through digital media. And the television experienced a really new responsibility by trying to avoid negative effects, disinformation, etc., and somehow providing a new platform for really critical discourse of state measures. So we see more and more now debates in talk shows replacing debates in the parliament of countries. Then the social media, I would call it the newcomer in that ensemble, and Wikipedia already paved the way, but by not only sharing available knowledge, but also about providing free access of knowledge in real time to all. What a revolution. But now in social media, they have a specific role as well. There's a freedom of speech to express, to gather, to record instantly and directly information for the people. That's great, of course, But currently we also face, of course, fake news, shitstorm, misuse, hate news, you name it. Yeah, so we have to face this and to find solutions. And now my next second slide. I would think about what are in this communication field now, what are the 3 top skills needed? And I see there are 3 main skills: literacy, diplomacy, and good governance. And literacy is needed as a means of identification, understanding, creation, and communication in an increasing digital, text-rich, text-mediated, information-rich, fast-changing world. Yeah, so on all levels and for all stakeholders, so not just the lay people, but also in policy making, etc. Then we have specific fields of literacy. We call it now health literacy, for example, concerns the knowledge and competences of persons to meet the complex demands of health now in a modern society. Or we have digital literacy, topic of today, again, having the skills to live, learn, and work in a society where communication and access to information is increasing through digital technologies like the internet platforms, the social media I mentioned, mobile devices, etc. And then a specific feature of that, I would say, or challenge, is a citizen science, yeah, under this health literacy. So learning by doing, and that the the practice of public and proactive participation and collaboration in scientific research to increase the scientific knowledge, and they even now part more and more of creating their own clinical trials, for example. There are many good examples. And then diplomacy, the second one, the second skill, the activity of managing relations between the governments of different countries, the skill of being careful to say what to say or what not to say. That might be even more difficult, tact sensitivity, yeah? These are keywords there. And it's a main instrument of global governments, which represents broader goals and strategies that guide the states' interactions with the rest of the world, agreements, manifestos we have being the result, for example, of long negotiations and processes. And then we have here also specific areas like science diplomacy, scientific collaborations addressing common problems and building constructive international partnerships. Or we have innovation diplomacy, facilitating using innovation to improve the relations between the countries and the current challenges at the crossroads of science, of technology, economy, culture. And then we have also like policy diplomacy, etc., etc. And the third skill, and for me that might be the most important in these times, is good governance. This is urgently needed, and it refers to all processes of governing the institutions, processes, practices through which issues of common concern are decided upon and regulated. And it adds a normative or even evaluative, I would say, attribute to the process of governing. And what we see, what are really essential ingredients, yeah, this is trust in government, like we saw it, for example, in Taiwan, Estonia during a pandemic, and also the understanding of cultural backgrounds, for example, Europe versus Asian countries. So in a nutshell, to close, I would say, in my very personal view, we need to focus more and more on, I would call it healthy marriage of social media and good governance. Thank you.
Thank you so much, Angela, for this message, healthy marriage of media, social media, and good governance. Before we go further, and I have the question about the good governance I will bring later to the whole panel for the discussion, but still focusing shortly on the social media. One question to you immediately. How do you still see the future role of social media, not only in the context of handling the emergency like the pandemic, but handling our crisis in the healthcare system, like in the bigger scale. Do you want to comment shortly on that?
Yeah, I think that's really an interesting question. What's the future? No? The current I described, because some people, they call it even now, it's the fifth pillar of democracy, the fifth pillar. But how to get there? Yeah. So next to legislation, executive, jurisdiction, and press, no? The four pillars. So the social media as a force, and I think there is a potential of window of opportunity. Yeah, by promoting an area of democracy which is influenced by the enabling technologies, the digitalization, that's quite clear. And currently, yes, a role is an active role in democratization of democracy. Yeah, by recording, interpreting, sharing, that's what I mentioned already, enabling access of the voice of people in the real time. But the future, there I think we need to have the capability not only to gather information, yeah, to distribute data and voices, but also to edit data in a more advanced way, and also by maybe stimulating content. And content in a fair way, in a transparent way, in an objective way, unbiased way, which is not the case in the moment. Yeah, shitstorms, fake news, etc. So a call for digital democracy, jurisdiction with moral values. So somehow like a fairness for all, to add to the WHO slogan, health for all. So I would add here really fairness for all. I think that could be the future.
Super. Thank you so much. Fairness for all, and of course, like not leaving anyone behind also here in that area. Thank you so much, Angela. As I said, we will come back to the good governance later, but now I would like to ask Ed O'Neill. Ed, you had the central role in the work on the digital solutions during the pandemic in the Northern Ireland, and we would like to hear from you about your experience and maybe also some message of hope for us, how to help recover the healthcare systems. So the floor is yours, and we can see your slide, but if you could make them a bit bigger in the presentation format, that would help us a bit. Super, thank you so much.
Thank you, Curley. I'd love to take credit for having delivered our pandemic response single-handedly, but there was a cast of many. So I will try and show some humility. I led 3 or 4 of our products. Okay, so thank you. I suppose first thing to note is, has already been touched on, the fact that the pandemic has been a once-in-a-100-year event. It's created huge stress on health systems, and that pressure is going to be felt for years to come. It's created a paradigm shift in our approach, and I think it's also helped accelerate digital adoption. You can see on the screen a suite of products that we delivered in Northern Ireland over the last 2 years that were key in our digital response to the pandemic to help deal with the restriction on access to services and social distancing. Any one of these products in peacetime would have taken between 1 and 3 years to deploy. We delivered these at pace and scale, often in weeks, and I think it's probably worth delving into how that was possible. I think we were clear that we needed to be effective, and we needed to create a digital shift to offset the pressure on frontline services. We also as well saw it as an opportunity to demonstrate an appetite for digital services, which I think we were able to do comprehensively. And also as well, we wanted to leverage our GDPR requirements to get citizens digitally identified and registered so that we could securely share health information with them, but also leave a legacy that we could build on going forward. It was also essential to us to ensure that we didn't leave anybody behind. So we were very keen to make sure that there were non-digital routes for services. But what we found is the more digital uptake, the more people were able to self-serve or create digital shift, the better access there was then for those non-digital routes and less pressure that there was on them, such as phone lines. We were also in a position where we used QA testing and accessibility testing to make sure all of our products worked effectively and that they were accessible. We also created sign language video relay services to be able to access for the sign language community the range of telephone services that were necessary during the pandemic. We were able to do things at pace and scale because we put citizens at the center of our design focus. When you design for people, with people, you tend to get better uptake of products. I'm going to focus in on just three of the products just to help illustrate the way in which we were successful. COVID Care was our symptom checker and self-management app. It was the second of its kind that was delivered in the world on the 27th of March, 4 days behind the CDC, who were first. We were able to develop that in 14 days, which was unprecedented. When we introduced it, calls to our pandemic helpline, which were at a level of about 6,000, went down to under 1,000 daily calls. At the same time, we saw 6,000 daily journeys through the COVID Care app, with people able to self-manage. 87% of those checking their symptoms were able to self-manage without accessing clinical services. So only 13% were referred onwards. We were able to deliver the entire product for 1.2 million. I'll come back to cost in a second. Stop COVID was our proximity app for notifying people of anonymous close contacts who tested positive. We designed and delivered that within 4 weeks. It was delivered on the 31st of July, 2020. It was first in the UK to be launched. And in close cooperation with our colleagues in the Republic, we were able to develop interoperability so that our proximity apps could speak to each other and citizens could move on both sides of the border, with the apps able to notify each other of close contacts. We also as well were able to shift the dial on digital adoption. We were able to go below the digital age of consent that was widely accepted at 16-year-old to be able to have post-primary school adoption. We worked closely with the ICO and our children's commissioners to make that happen so that children could consent and use the app themselves without the need for parental consent. We found that our digital proximity app was more effective than manual contact tracing. You were getting notifications out instantly, as opposed to up to 72 hours on a phone line with direct contact, plus the ratio of index cases to contacts was 1 to 2.5 compared with the manual, which was 1 to 2. And we delivered that for 1.2 million. So both those apps were delivered for 2.4 million. I would benchmark that against our colleagues in England who were able to deliver their app in the September of the same year for a cost of 34 million. So we think that was quite good value for money. Our COVID certification service for travel and domestic certification was stood up in 4 days. We had a fully automated digital solution from scratch within 21 days. We'd support for non-digital with a full helpline and printed certificates being posted, but 93% of the public, the certificates that were produced were done so digitally. So there's a high rate of adoption there for digital services. And we've left with a legacy of 61% of the population over 16 that are digitally registered with a verified identity that we can leverage to deliver future services. The entire cost of that service for the digital and non-digital was 21 million. If you compare that to the National Audit Office report on GovVerify, they spent 21 million and only achieved 5% adoption. So we think it represents exceptional value for money. I think it's fair to say that what we did was done to a reasonable standard and for good economies in terms of finances. And that was possible through agile delivery. We had an enabling environment with funded discovery, with rapid financial approval processes to be able to get things out the door. But we also focused on using design with citizen participation in pre-production testing, both interface and interactive design. We also used a multi-vendor approach with public-private sector partnership, but we had companies marking each other's homework. So one company providing QA testing and making sure that the delivery was done to a good quality. So our automated identity checks achieved 80% automation as opposed to the industry standard, which is about 65%, or GovVerify, which is 42%. We also had a helpline with product support, so we were able to get direct feedback and iterate rapidly with each sprint to make sure that our products were very rapidly developed at a pace and scale that made them viable almost immediately. We think that's been incredibly successful, and we hope to pivot towards a digital delivery center to continue delivery into the future using Agile across government, certainly for the projects that need a rapid response. But we also have a legacy where 73% of our population now have a government digital account, and 61% have been identity verified with biometric checks against identity documents and a light credit check as well. That's quite an important thing to leverage. If you look in terms of Estonia, Independent verification would suggest they have about 70% of their population that are actively engaged with digital services, as opposed to our 61. But we think we compare quite favorably with our colleagues elsewhere in the UK. The benefits of this are quite clear. If you look at independence reports, whether it's McKinsey, Gartner, by leveraging digital identity, you can have a GDP boost of 3 to 13%. You also can find Estonia, just by its tax returns alone, saves about 2% of GDP. So you're able to do more with the same resources by leveraging digital. And we found, for instance, our automated identity checks were 10% of the manual cost of an identity check. So there are huge economies for governments going forward, particularly in the current environment of spending constraint. So it's our clear strategy to try and derive end user benefit with a range of services to drive adoption across government and leverage those economies of scale to be able to do more for the public, and leveraging interconnectivity with joined up services through cloud. That's really important in healthcare. As you're probably aware, in the UK, we have some of the lowest levels of doctors and nurses in Western Europe. And that's material because even if we were to boost substantially our health spend now, it would take about 4 to 5 years to train a nurse and up to 10 years to train a doctor. So unless we do something now immediately with digital shift in the short term and agile delivery, our ability to deal with increasing demand as we emerge from the pandemic is going to be limited. So looking to the future, we're already linking our digital identities to our health and care number index. We're leveraging our epic delivery in secondary care with community reach out through the MyChart function, digital GP registration and validation. We're also looking as well in urgent and emergency care to a range of products with a white paper published looking at single point of entry, improving GP access and optimization of service delivery. But our overall strategy is really digital shift, digital optimization, and data business intelligence. Some topics that probably have been touched on in the earlier by our earlier speaker and presentation, and obviously as well will probably be touched on by others. But I think key to this, and what's been a paradigm shift, is that we now have strong digital leadership. Our head of civil service comes from a digital background, and Dan West, our Chief Digital Information Officer, has a long track record of delivery in public and private sector and has been key to creating an enabling environment. Thank you.
Thank you so much, Eddie. This was very fast delivered, a lot of information. And again, I will also invite you to comment on some of those issues in the later part. But I maybe just one quick question. You showed a number of those products and services developed during the pandemic. Do you see that they will stay, or they will be somehow repurposed, or, as you said, that the pandemic is once in the 100 years event, they will be put on the shelf, but at the same time the learning and all this enabling environment that will prevail? Or do you plan to still develop and keep some of those services going on?
I think that there will never be a full move back to untriaged care. I think that, remote consultations will continue to be a focus of healthcare delivery as well as face-to-face. I think that some of the infrastructure that we've built, so the digital identities and linking that to health and care number, will be able to leverage into other services. We've also done some interesting stuff around visitor booking services that we help to try and sort of create virtual visiting and restriction of visiting to hospitals for infection control. The infrastructure that we've built there is going to help us to create visibility of our bed flow management system, to be able to have a regional air traffic control, so managing winter pressures. I think also as well, data has been key in our pandemic response. We all saw slides across different countries with public health officials showing curves and how we were trying to flatten curves. And I think suddenly people have realized the importance of health intelligence to drive your response to things. And I think that's not going to be lost. Whereas previously trying to get modeling and health data used for winter pressures and flu management was an uphill struggle. And people were too focused on operational delivery and not appreciating the importance of business intelligence. So I think there's huge opportunities off the back of what we've done going forward. And I would say that Northern Ireland's not alone in that process. I think most countries see that we need a paradigm shift, particularly in healthcare, towards digital delivery.
Super. Thank you so much for commenting on that. And with this, we will then move to another country, to Republic of Ireland. And here, Martin, you're helping enable the digital transformation of Ireland's health service. And we are looking forward to hearing from you about the experience. And how, in your opinion, how does data and digital services can support? Yeah.
Brilliant, Carolina, and good morning, everybody. Thank you, Bledden and team, for the opportunity to present. I've very much enjoyed the two previous speakers as well, and I hope to be able to sort of build on what was shared. So just checking everybody can share my screen.
Yes, Martin, and I just, it happened to see that you have 52 slides, but we have 7 minutes here, so I hope.
We'll hit 7 minutes. So I'm here in Rotterdam, actually, at the Global Digital Health Partners Organization, and actually people here send good wishes to you, Bledden and Brian and others. So I want to talk in 7 minutes around what we call stay left, shift left, 10x. And this is what we're proposing as a new paradigm, policy, platform, and prescription for fixing global healthcare. And a lot of the principles are based on a book I'd written with a colleague from the European Commission called Open Innovation 2.0. And in that book, we talk about what are the design patterns that are necessary to drive a structural change in an industry. And the most powerful pattern that we have is data-driven innovation. And of course, this session is about digital and data, in terms of transforming health. So just to mention, last week, Brian O'Connor and I and many others were in New York for the United Nations General Assembly, and we attempted to replicate the famous Solvay conference of 1911. And we brought 50 of the world's thought and practice leaders into New York for 2 days to look at how can we move this agenda forward of stay left, shift left, 10x. And what we're doing in Ireland is Harvard Business Review has been talking about grand coalitions as the new way of fixing intractable problems. And I think everybody would recognize healthcare around the world is on an unsustainable trajectory. But we have recognized in Ireland, as so other organizations, that there is a way to fix healthcare, but it's not through marginal gains, it's not through incremental innovation, it's through true, disruptive, digital innovation that delivers 10x benefits, 10x faster, 10x cheaper, 10x better. So I'm representing, I have multiple roles. I'm chairing the Irish Digital Health Leadership Steering Group. I'm a professor of innovation, but I'm also head of digital transformation of the Irish Health Service. So we're proposing a new doctrine. Lincoln 150 years ago said the dogmas of the quiet past are inadequate to the stormy present. And we kind of have been practicing a dogma in healthcare is just put more money in, the traditional way of doing things. But what we see in Ireland and other countries, costs are going up, waiting lists are going up, debts are going up. And, I have to commend Ed on the response in Northern Ireland. COVID really was a big bang disruptor. Well, we've tried to make healthcare really simple. So stay left is about keeping people well, or if you happen to have a chronic condition or need rehab, you can do that best of all from home. Hospitals are really nasty environments. Lots of people go in, they leave with infection. So we want to keep people at home. Shift left is about moving patients as quickly as possible from acute to a community to a home setting. And we already have in Ireland, in homes, we're able to have better vital signs than you actually have in our most modern hospitals. So that's what shift left is about. And 10x is the idea that we can build 10 times better health systems, 10 times better health. And we're actually proposing a new doctrine. So in New York last week, we declared war on disease. 70% of deaths are due to preventable chronic disease. In the US, 90% of every healthcare dollar is spent on, treating chronic conditions. 47% of chronic disease related to obesity. In Ireland, Republic of Ireland, over 60% of our adults are actually classified as obese. So we're storing up a massive problem for the future. So what are we doing about it? Well, digital health is a new discipline, and it's the interplay of health, of digital, of economics, of demographics, of genomics, data science, etc. And the Canadians absolutely have it right. Data is the greatest weapon we have to fight disease. And the idea that we'll have closed loop digital medicine, you know, at our fingertips very soon it's almost a reality. So when you have a doctrine, you need some principles, and we've identified 10 principles in Ireland, and these were fairly warmly adopted by the UN community last week in terms of how are we going to fix healthcare. We want to leapfrog, and I'll explain what this leapfrog from laggards to leader, from systems that are clinician-centered, are acute hospital-centered, are paper-centered, to ones that are patient-centered, that are home-centered, and so on. Probably the most important is the idea of network-centric health. You know, the network is always going to be more powerful than an individual GP or an individual hospital. I've been applying some of the principles of network-centric warfare to network-centric health, and we absolutely can move from an environment where information suppression seems to be the modus operandi of health systems to where we move to information superiority. Patients and clinicians are making their decisions based on the best possible available. It's less information available. It's estimated today doctors are making data or decisions, you know, based on just 17% of the data. So I talked about the idea of high impact coalitions. It's about a quadruple helix: government, industry, academia, and citizens working together. So what I would suggest is there are 3 Copernican shifts that are happening. The first is the need to move from an illness to a wellness system. There's much higher returns, and it's better for everybody if we're keeping people well rather than fixing sick people. The rule of rescue still needs to apply, but let's put a lot more effort into keeping people well. We need to move from doctors know best to patients know best. Then lastly, we need move from hospital to home. And McKinsey, or one of the supporters of our doctrine, are already saying that by 2025, 40% of the care that's currently provided in a US healthcare facility will be provided from home. That's just a couple of years away, and that is possible. And Eric Topol famously wrote, "The patient will see you now." So we want to, you know, instead of, you know, healthcare revolving around a doctor, it's going to revolve around a citizen and a patient. So healthcare's 10 years behind other industries in digitalizing. It's about 30 years behind manufacturing and the airplane industry in applying, you know, common techniques from Shewhart and Deming, statistical process control and theory of constraints, to how do you manufacture systems. We're at a unique point in time where we have all these disruptive technologies all showing up at the same time, and we can really disrupt. So I mentioned the idea of leaping ahead. So many countries, developed countries, are in the middle where they've deployed electronic health records, you know, to their hospitals. Ireland didn't do that. We did want to do it. We just couldn't execute. But where we're moving to is everything will be centered around the mobile phone. On my phone, I actually have a personal electronic health record. You know, it has my colonoscopy, it has my MRI. Very shortly, it's going to have my whole genome sequenced. And when I go to the hospital or when I go to my GP, this will be the single source of truth. Yeah. And we're building a capability maturity framework at Maynooth University with the support of Medtronic and Cisco and Huawei and Dell. So we're building a national roadmap for countries to measure actually how good are you, how do you measure your levels of maturity, and where should you go next. So our goal, Ireland probably has the worst healthcare system in the Northern Hemisphere, but within 3 years, we want to be in the top 5 in Europe. One of the critical insights.
Martin, may I interrupt you?
I'm finishing the last minute.
Yeah, all right, perfect. Thank you.
So the determinants of health, only 10% of health is actually delivered by investing in clinical outcomes. 40% is around nutrition and behaviors and, you know, and exercise. 30% is about genetics. So I just want to share 2 examples of what we're doing. We've recently launched a living lab with 11 companies where you can go to your local pharmacy, you can get a full test in 15 minutes, blood, spirometry, you know, AFib test, and within 24 hours, you get a personal electronic health record, you get a full health check, and you get enrolled with a Fitbit device. So this is about really walking the talk on staying left. So Ireland, a lot of health services are really good at publishing glossy reports with great aspirations, zero delivery. We're trying to do the opposite. Ed talked about
I think we lost Martin. I don't know if it was only me or.
Okay, well we'll finish there. I'll hand you back to Caroline.
Sorry, so yeah, it froze. Your video froze. Sorry for that.
Just
but I wanted.
Mention,
but if you were back, if I may ask you a question.
Sure.
Yeah, because, thank you. You mentioned just a short question, and again, this is also something that actually I could ask all of you, all of our panelists today. You mentioned that the COVID was disruptive, and of course also that there was an opportunity and we don't want to leave anyone behind. At the same time, I'm sure that there are some people who didn't really embrace all the digital health and e-health opportunities. And now you are also proposing radical shift. So I wonder, how do you plan to communicate this to people to really also gain their support, as I believe that many people are now just like, they really want to come back to normal, and then some see the advantages of the digital services, but for some populations, I'm sure that this was not something that they fully interacted with and enjoyed. So if you can shortly comment on that.
It's a great question, Caroline. And what we want to do in Ireland is repeal, the inverse care law. And that means, the people that need care most have the least access to it. And I really liked what Angela, talked about. So what we were doing, we're working with the major, media organizations, the Irish Independent, the Irish Times, the Sunday Business Post. And all of those have been carrying articles around what this digital transition is going to involve. And the first step to transformation is about awareness, and that's hugely important. And I've been really pleased. Jerome Adams, who was the first Black American Surgeon General, we're starting to work with him. He's moved to Purdue, and he's focused on health equity. And in the same way that cloud computing has democratized computing, we think digital health is going to democratize health and really ensure health equity. So here in Rotterdam, we've been talking about the intersection of health literacy, digital literacy that gives rise to this new digital health literacy. We know that patients that are less digitally health literate spend 4 times more on health. They spend 4 times more in hospital. So it's really crucial that we engage the media to actually educate our citizens that there's actually something different happening, and this is going to be good for them, and it's going to be good for the system.
Thank you, Martin. And I think this very well connects to the previous speakers, and especially Angela's message. Just one comment from our audience, not a question. 100% for Martin. Everything digital, everything connected, blockchain and accountable. How do we enable and empower the human? Statistical and financial data to easily map the results on dashboards. What is required is a highly scalable data lake that can process and configure the data to display to every individual affected. Data ownership, digital accountability. Great presentation. So thank you for the presentation. And with that, we will then move to Julien Venne. Again, he's director at the Digital Health Society and also researcher affiliated with the European and not European universities. And yeah, Julien, what is your reflection on that? Maybe you also want to reflect already on what has been said. So please, the floor is yours.
Thank you very much,
can you, I don't hear you very well, but...
No?
Much better. Thank you so much.
Okay, sorry for that. Because I was saying just thank you to you, to Bladin, and to the organization. I'm very happy to be on this panel with these great co-panelists, and hello to the 3 of you today, and hello to the audience. So yeah, I wanted to share a few slides as well, but I will be quick because a lot has been said already, and I will try to connect with what has been said before. Do you see my screen correctly?
Very well, thank you.
Thank you. Okay, so first I wanted to speak about the lesson learned about this pandemic and this crisis globally, and basically my message today is to say think in system and maybe think out of the box. This was the idea of these few slides. To say that what I've learned personally or I remind during this COVID crisis was the systemic nature of the world and the systemic nature of the work we are doing in healthcare. And actually the fact that we are not accountable, or at least healthcare systems are not accountable for health of the people and some other factors, some other stakeholders, some other data we will see are needed if we want to speak about the health and the well-being of the population and how the population are striving. So the first thing I wanted to mention is this slide on One Health initiative. So it's a very famous initiative from the WHO. Actually, One Health is basically to say that the health of humans is connected to the health of the environment and the health of the animals. And actually, this COVID or zoonoses in general are always reminding us that we are not alone on this planet, and that we have to take care of the other living members of this planet, so the plants, the nature, the animals, of course. And this is something that we've lost a bit during the 20th century. Actually, it's a whole idea. The One Health idea come from the 17th or the 18th century, so it's not new. But actually, we almost forgot that in the 20th century to expand the economy, to expand the industry, and to do our human activities at the maximum. And actually, it came back at the beginning of this century, on the 2000s, more or less. And the initiative of the WHO, the United Nations, and other organizations now have joined to emphasize the fact that we are all connected, all living entities in this planet are connected, and we have to deliver on the other aspect of health as well if we want to be efficient. By the way, with the Digital Health Society and the ECH, we've just launched this summer a green health initiative, which I think is very much needed at the moment, and many initiatives are focusing on that. As a rural guy from the south of France, I had to put a picture of silos. I'm coming from the field, but here not to speak about agriculture, well, maybe a bit, but to speak about the way we work. As humans, we always work in our boxes, in our sectors, in our systems or subsystems, and we are not connecting the things. So it's obviously a message that we all deliver, all on this panel, all in ECH Alliance deliver for years, but it's always useful to remind that the way, and actually COVID showed us a lot that the way we are working, the way we are living, thriving on Earth is most of the time piloted by a silo decomposition of the reality. And we have silos between the domains. We have seen that there was a huge debate during the pandemic between should we prioritize health over economy, should we prioritize economy over health. So we can have, or should we prioritize climate change crisis, which was the #1 topic before COVID and after COVID as well. So do we have to park this environmental climate change challenge during the COVID or the health crisis? So we tend to separate the things, and we tend to classify or rank the things together. And I believe it's a mistake we are all doing as human. We have as well silos between people. We have seen, and it's obvious during the pandemic, and we know that for years in healthcare and digital health as well, that people have to work together to build strong solutions and efficient solutions. Actually, the solutions which are not co-created between the stakeholders are useless solutions most of the time, or at least are generating perverse effects towards a part of the population or part of the stakeholder ecosystem. And if all the ecosystem is not together, it doesn't work. And the policymaker had to have scientific committee at the national level in most of the European member states, for instance, but it was the case in whole country in the world. We need scientists and we need science to understand what is happening. We need healthcare provider to understand what is happening on the ground and how the organization could be better and more efficient in the hospitals. We need companies and startups to do innovation. We need citizens to explain what they expect as well in terms of organization, in terms of policies, in terms of resources as well about that. And we have seen, and Angela mentioned that, the lack of trust we had from the citizens. Actually, we just at the moment of the pandemic, we said, hey, we need data from you. So take this app and give us data. And I think it was a bit late to involve the citizens in the healthcare planification, and we need this kind of direct input data for driving the strategy. And had mentioned that as well before. We need that to drive our actions. And of course, we come to the topic of the day, and the 2 days. The data silos. We had very much difficulties, well, at least in my case, very much difficulties to retrieve a series of data sets, not coming from healthcare itself. Even if we had difficulties in healthcare, of course, it's, as you said, Martin, we are one of the latest sector to digitalize fully. So we are not in advance on that, for sure. But we are as well lacking of bridges with other sectors and other types of data that we need. The mobility was an obvious data set so that we needed to manage pandemic. The financial health or the financial well-being of the people was is in jeopardy as well at this moment, and we needed a collaboration with that. We needed more direct, I was saying that just before, direct data coming from the people, how they live, how they move, how they feel, what kind of symptoms they have. And this is not easy if we don't have a governance in place, as Angela mentioned, for that. Even for leisure, to understand what people are doing when they are not working and not doing economic activities. So one word, we have to break down the silos. It's obvious, but I think it's important. One important thing here, this slide, to mention one concept we are working on with my colleagues at the moment is the human digital twin. So how we, beside the digital twins we have created of hospitals, of industries, of cities, we have smart cities now, and we have kind of digital twin, digital images of what is happening in a city. Why we don't have the digital twin of each of us, and how a citizen can't be in control of my digital twin, the data version of myself. Would be something very important, I think, to develop for the future. And we have seen, last comment, we have seen a lot of superheroes during this pandemic, and I wanted to mention them. The problem with superheroes is that they are exceptional, so we don't find every corner a superhero. In this case, during the pandemic, I think we found in each hospital, each healthcare provider, some superheroes, but as well beyond the healthcare facilities. And basically, the superheroes have to be superheroes and use superpowers because they don't have the solidarity of a group to collectively achieve a task. So they have to be superhumans or super people to achieve this task. And again, it's I take the previous slide, break down the silos, break down the barriers and the frontiers between the people, and the collaboration between each of us to be able to be resilient. And actually, on the title of this session, we talk about recovery. I prefer the word resilience personally, because it involves a much more idea of the ability of a system. I put here one definition. You have thousands of definitions, of course, of resilience, but I put the UN definition. It's not always to come back to the previous situation. It's trying to function, trying to work, trying to operate back after a crisis or during a crisis, and to adapt. The adaptability is key, but it's not always to come back to the initial situation. So hopefully we will go out of this crisis and the current crisis with new models, new ideas, and the stay left, shift left proposed by Martin is one very interesting option to explore and to align with.
Thank you.
So I was mentioning that. one last
yeah.
thing I finish to take my first message. We are not only healthcare professionals. I mean, we are not only working in healthcare. We have to work on other things. We are at the moment of a very disruptive moment in the world, and I just mentioned here this Antonio Guterres quote from 2 weeks ago, actually, with Martin in New York. Antonio Guterres did a very interesting speech. We have a duty to act, and we need to change the system and to transform completely the way we are doing. Just for the cost of living is raging, trust is crumbling, inequalities are exploding, planet is burning. I don't want to accept this diagnostic. We need to act to change that, and we need to act collectively and break the cycles. That was my message. Thank you.
Thank you, Julien, for this message of hope and also resilience. I think resilience go beyond the recovery and also shows a bit of sustainability. And I have one question starting from you and also asking all our speakers for the final message from the session. We heard here, I collected some words: good governance, transformation, trust, cross-sectoral, nobody left behind, whole of system approach, of course, resilience, recovery. But also, of course, all this was given in some context of the emergency, like thinking about the pandemic that was being handled like under the conditions of emergency, which of course sometimes break us, but also often mobilize us and the governance to really act as superheroes. So then of course breaking the silos and then coalition building. So for the future, what do you think, like how can we really build those coalitions sustainably so that we not only survive this winter of this content, survive this, get out from this perma crisis we are now, recover from the pandemic, but also build this long-term resilience? What is your short response to this big question? And Julien, if you can start shortly.
Yes, thank you for the gift, because your question, I could talk for hours about this question.
You have 1 minute.
Well, yeah, I will just mention one thing. Last week I was in a group at the WHO to talk about green health and decarbonization of healthcare. So how healthcare can contribute to climate change. And it was very interesting to see how healthcare people were thinking about climate change problem. And it was a different approach than the climate experts usually have. And most of the people, they don't know very well. They have to learn first. So the group of the WHO is here to educate people and then to give tools and to solve the problem. What I think is the question of value. Where do we put the value in the society we are? Health is important. We know it's important for every human on this planet. I will be in India at the end of the week, the same in Europe, the same in US, in Africa. So the value of people as well. We rate much higher a big CEO of a large company than a vendor in a supermarket. Well, during the COVID, I would prefer the vendor on the supermarket, honestly. So what I mean is the value is not the price tag. The value is not the money you put on it. So what do we want as a society to be in the future, and how do we achieve that collectively? Because being in good health is not a question of healthcare professional or healthcare systems. It's a question of everybody. Being happy is as well a question of other sectors. So really, I think more we will have forum and places and platforms where we can cooperate between different people, like the example I was mentioning with climate experts versus healthcare experts, talking about one problem. More we will have that, more we will be able to be resilient and so to adapt to the future crisis, because this is not the last one and we will have to change the way we work.
Thank you. And what about your view, Martin?
Yeah, you know, there is this winter of discontent, but I think there's a huge optimism. The idea of citizen leadership, or, you know, Harvard wrote about this grand coalition. I think sort of the institutions of the state and, you know, are failing because our organization, you know, there just isn't the agility. And I was just talking earlier on the GDHP, there's such fear in healthcare in terms of, you know, making decisions. I think, you know, the Hippocratic Oath has been misinterpreted. Instead of, you know, do no harm, it's do nothing. But I think organizations like the Digital Health Society and the GDHP that I'm here, these informal organizations, actually, we can mobilize together and we can actually make things happen. So it's up to us to assume responsibility, and, you know, the kind of response that Ed drove in Northern Ireland to the pandemic, the emergency that we have in our healthcare systems, you know, with waiting lists going up, and you know, is as real as COVID. In fact, it's actually more urgent than the COVID response. So we responded well to COVID, but the crisis we face is actually much more serious. So let's mobilize with the same enthusiasm. And I think the Digital Health Society and the people on this call are all really important stakeholders. We can't actually wait for governments and national health organizations to drive the change. You know, a group of committed global leaders can come together and actually make this happen. And as the Canadian said, data is the greatest weapon we have to fight disease, and we need to declare war on disease. There's too many people dying unnecessarily, too many people suffering. We actually have the technology, so let's just scale and do it.
Thank you so much. And Eddie, what's your message?
I think that effective digital delivery is essential if we're going to be able to do more and meet the increasing demand with limited or less resource. I think for it to be effective, we have to put people at the center of our design focus. And actually, effective digital delivery only happens in the context of service design. I think that service design has to be equitable and inclusive. So when you're designing digital delivery, you also have to have your alternate non-digital route. And then I think that allows you to sell a positive message that everybody can buy into, that if those who can use digital services use them, they free up traditional routes of points of access for those who can't. And we can support the staff that provide those traditional routes of access, whether it's telephone lines or face-to-face, with better digital products so they can make better decisions and deliver things more efficiently, and there's fewer steps for people entering at the point of entry to an outcome. So I think if we take that whole systems approach and think of digital delivery as actually just better service design, and one of the sort of key learnings I think we've had from the rapid development of digital products is when you try to do things digitally, you uncover the inconsistencies of service delivery. You uncover as well the lack of information driving service delivery, and how we lack business intelligence in many areas, and how there's really disjointed delivery of healthcare. So I think digital becomes a great enabler to join things together and reduce the inefficiency in the system. So that's a number of messages, but I think it's a coherent thread of thought, and hopefully I've been able to deliver it effectively. Perfect.
Thank you so much. And the last word from Angela.
Yeah, I have a very short message, and I really believe the key is good governance. And so bottom-up democracies under a very strong leadership, like we saw it, for example, with Winston Churchill in war times, yeah? And then balancing freedom and trust. And I also mean by this, not to regulate too much. That's what I see in the moment. And even with, I'm very provocative that I'm not into regulating social media, for example. Yeah. So a strong leadership, bottom-up democracy, and I think to live more with gray zones.
Thank you so much for this discussion on how the data and digital services can help support the recovery of the healthcare systems. I think we got even further than only the recovery. We spoke about the resilience. There is a lot of different messages, and as Martin said, we should assume responsibility, and definitely the community around the Digital Health Society and the European Connected Health Alliance group is the group of stakeholders. So if you're looking for partners to this work, you all listening to this, and then please reach out and stay with us for the next sessions. We will take now a very short break, and we will come back to actually with the message from our community director on why working with ecosystems, the systemic approach, all of stakeholders approach is important. So thank you so much, and stay with us.
Thank you.
Thank you.
Thank you, Julien.